Hey everybody, it's Marlon with Chronic Pain Warriors United. Welcome to the channel. Hope y'all all had a great weekend. Filming this one on Sunday evening-ish, and it's probably going to go out tomorrow morning, be it Monday morning. So I wanted to jump into a topic that I've talked about a little bit beforehand, and it's improper reductions of medications by both primary care doctors and more so nowadays pain doctors in general. And what got me going about it was not just that, but a comment from George Washington the 12th on one of the videos I just did about his doctor switching him and pretty much, from what his comment said, everybody else at the pain clinic's practice from traditional pain medications over to buprenorphine, not Suboxone. It doesn't have the naloxone in it, according to his comment, but still buprenorphine. And there's a lot of reasons why I think they may be doing these types of things, and I'm going to get into them in another video. But that fits in with the non-consensual way that doctors are going about these issues now. Informed consent is a pillar of medicine, or it was, that has been absolutely burned to ashes. And doctors now are acting on their own accord against patient wishes without their consent many, many times to taper or lower or reduce their medications. And it's just wrong. So I wanted to go into some of this from the 2022 CDC guideline prescription updates, where they talk about improper tapering of medications, how to actually do it, how doctors and the DEA have created a situation that has caused harm to a lot of patients out here. And one reason, like I said at the beginning, that I've talked about this before, and this is an issue near and dear to me, is because it's affected me, but it's also affected people in my life that I love. My grandmother had her pain managed by her primary care doctor for about a decade. It was great, had effective pain management. She had a back problem from falling off a stool and landing on her back, and there was a lot of damage back there. But his first response was not to reach for a scalpel or to recommend dangerous surgery. His first response was to try and manage the issue, which is what I talked about in the failed back surgery syndrome video I did. It seems like a lot of times the doctors are just reaching towards the scalpel, and he didn't. And that was up until the point the DEA came to his office one day, audited his practice, his prescriptions, and said, "You have far too many opiate and other narcotic prescriptions." And he had many older patients, by the way, like my grandmother. And they were like, "You've got to reduce it by this ridiculous percentage." And I don't remember exactly what it was, but it was over half, I believe, within a month. And that forced him to get rid of a lot of his patients. And then my grandmother was forced into a pain clinic, a pain doctor she didn't know, and he immediately started tapering her medications at a level that was absolutely criminal and unscientific. And I just want to go through several of the bullet points that the CDC makes about this, because some of it is on point, and then some of it is just asinine and back-asswards crazy. So one thing they say is the misapplication of the 2016 guidelines include, quote-unquote, rapid opiate tapers and abrupt discontinuation without collaborating with the patient. I mean, really, that is just abandonment while running over the patient's quality of life. And doctors, especially pain management doctors who new patients are seeing or going to, are doing this all over the country all the time. to the detriment of not just people's quality of life, but their whole life in general sometimes is ended because of these things. And I'm talking about now individuals who've chosen to end their own lives because of doctors' actions like this. And there's been quite a lot of them that have been reported over the years. Another point they make later on, tapering or discontinuing opioids in patients who have taken them long-term can be associated with clinically significant risks, particularly if opioids are tapered rapidly or the patient does not receive support during the taper. And I don't know about y'all, but when have I have not heard of a doctor sitting down with a patient and saying, hey, here's what I would like to do. Can we sort of work out a plan that you think would be okay too? And when the patient says, no, I don't consent to that, it's going to destroy my quality of life, the doctors don't say, okay, well, maybe we'll revisit it or something. They just say, okay, and then they start doing what they were going to do anyways. Non-consensual medicine like this is the antithesis of everything medicine is supposed to be, along with the fact, we're supposed to be free. We're supposed to have freedom to pursue the type of healthcare that best fits with us and helps improve our lives. And they have put up roadblock after roadblock after roadblock and made us climb Mount Everest to get to that point. And it is an abridgment of our not only constitutional rights to the pursuit of happiness in our own lives, right at the very get-go, but it's also an abridgment of our human rights. No man, woman, bureaucrat, badge, anybody has the right, doctors included, to stand in front of another person and say, you are not qualified to, have pain relief. You have to live in pain. And since we're the ones who decide, we've decided you are not worthy. It goes against everything I believe. And it has done so much harm to so many people across this country, especially our elders, right? Who this is happening to at a much worse rate because they require these medications more. Anyways, let's keep going. And I had written after that I just said, it's like, they have increased mental health problems, increased potential for self-harm, along with stomping all over the patient's quality of life. And that's what doctors do when they do these rapid tapering without, the consent of the patient. And then the next one, when patients don't consent, this one pisses me the F off. When patients don't consent to these draconian anti-science madness, the CDC tells the doctors when the patients, disagree, quote unquote, acknowledge the discordance, express empathy, and seek to implement changes in a patient-centered manner while avoiding abandonment, which is basically, quote unquote, tell the patient you hear them, you understand that they don't consent to what you're doing and that it's going to hurt their quality of life, and then completely ignore them and act against their interest regardless of consent or not. That's really what the CDC says in the 2022 update. It's like y'all provided this update years too late after states and the DEA have already codified a lot of this craziness into law and regulation, and then you just spout nonsense in it like that. Like you say some good things, and then you come back behind yourself and you're like, look, the vast majority of patients are not going to consent to having their pain relief taken away, the quality of their lives destroyed, and having a doctor and a government agent come between their quality of life and pain relief. So when they don't consent to that, Just ignore them because they're just the patient. They don't have any power anyways, and do what we're telling you to do. It's so wrong. And I don't even understand how doctors can, in good faith or conscience, do these things. There have got to be some doctors seeing these videos at some point now. How do y'all live with yourselves? And then they talk again, quote unquote, doctors should work with patients on a tapering plan, end quote. This is just so ridiculous after what they just said before this. It would be hilarious if it wasn't so ass backwards and sick. I mean, they just said the exact opposite. It's important to work with the patient, especially if you want a successful taper. But, if they're not going to go along and they don't consent, then just cut their medications non-consensually and move on. They're just the patient. And then again, there's another one, taper slow enough to minimize withdrawal symptoms. Now, the pain management doctor who my grandmother was forced into completely ignored this. He's tapering my grandmother, who is 80-something years old at the time, so fast that she's in withdrawals almost constantly after every visit. And I swear that had a negative impact, not just on her quality of life, because that's obvious, but on the extent of her life. This doctor shortened her life, I have no doubt. But even when we complained about it, he just kept jolly on forward, It makes me so mad. And that's a joke too, like I said in here. The doctors cut like mad constantly without patient consent. They could care less what it does to the patient. That's just obvious. Improper tapering proper tapering can take months or years to achieve, and improper tapering for patients like my grandmother, it took months or years off of her life. And then the last thing I was just saying, proper tapers can take months or years. Proper tapering with the informed consent of the patient can take a good long while to actually achieve if the patient agrees and it's done properly. But when you don't have buy-in from the patient, which the vast majority of these doctors who are doing this don't, because the patients know what's happening. They know that it has nothing to do with medicine, has nothing to do with improving their health care, and it has nothing to do with improving the quality of their lives. This is all political at this point. The DEA and the federal government and state governments and governors and on up, a lot of them have decided that this is a political issue that they can push again and again come election time, and they've been right. But it's time for the other side, us, to say, look, we've been y'all's punching bag for far too long now. We're not taking it anymore. We're not taking the lies. We're not taking the bullshit. And on top of that, we are not going to let you continue destroying the quality of life of millions of Americans every year, with God knows how many choosing to end their own lives because of it, or dying from opiate-related overdoses or things like it, trying to self-medicate on the black market. We've lost far too much blood and treasure, and everybody, so many people in this country are suffering, from our elders all the way on down, for no reason at all. There is no point to continuing what they are doing. Everything that they have done was supposedly to prevent more opioid overdose deaths. And the exact opposite has happened while destroying the quality of people's lives. 18 million Americans suffering from high-impact chronic pain, and they have crawled into every portion of our healthcare. So anyways, George Washington the 12th talking about his doctor non-consensually changing all his patients' medications from effective traditional opioids, which are cheap, by the way, to buprenorphine, which is not very effective for a lot of people when it comes to pain, is extremely expensive, and we have no idea what the long-term consequences of taking it will be. None. And yet, the DEA and doctors are handing that shit out like candy. That is the new pill mill system for real, if you really want to go there. But when it comes to traditional, effective, safe pain management tools like opiates, asking a doctor to go that route, like I said in the short the other day, it's like asking them to cut their own goddamn arm off, it seems like. Anyways, that's the end of this one. Hopefully, I'm trying to get these more compact and stay on point. So any of you who have stories related to what we're talking about, non-consensual, your doctor's acting without your consent, non-consensual tapering of medications, inappropriate tapering, how it affected you or your family members or loved ones that you watched it happen to, all that. Like I say in every video, you and your stories are unique and special, and they will help and contribute a great deal to the cause of reform. So be sure and leave them. Hit that like button and hit that subscribe button on the way out. I'm Marlon with Chronic Pain Warriors United. I hope y'all are blessed and be well. Cheers.